Okay, so keeping with the theme of catheters and looking at least restrictive approaches, obviously for men, we have the condom catheter or the convenes, as they're commonly known. Have either of you or any of you used convenes on men? No, okay, it's fine. Again, I'm going to bring one out. You'll get an opportunity to put it on a penis and play. So you get to try those. So basically, fitting a convene catheter, same principles. You need to make sure that the penis is clean and dry. So again, top of the urethra coming down. And it is just like a condom. You would slide it onto the penis, you pull it back, and the top of that condom, there's got a bit of glue. It's quite sticky, and it naturally sticks to the penis. Couple of the problems that we have with men's penises. One is pubic hairs. So if they've got pubic hairs, it's easier to have them cut so it's nice and tidy and they don't get caught in the glue. And the second problem you've got is the men's length, because we know as men get older, sometimes it doesn't go so well for us men, and you can end up with a much smaller penis than others. So what's useful is you can get a bit of gauze around the penis, and then that way you can use the gauze to tug the penis, pull it down, and you just use the tape around the top. So they're easily fitted. The downside to condom catheters is they don't last very long. So if a man has quite a large urge to urinate, the catheter can explode. It just pops off like a balloon. So it's about realizing, is this the right method for a man? So if they've got a small penis, it can be really difficult because there's nothing for it to stick onto because it goes on the outside. So again, it's about assessment, and no man is going to want you to say to them, your penis isn't the right one for this catheter. So it's just about being really dignified and kind of going, I don't think this is the right option. Maybe we should be looking at this. But again, your incontinence nurse can let you know. They're ideal because they're obviously external. There's no urethra stuff. You're not going into the urethra. So therefore, they are safe and clean. And it works exactly the same way as a normal catheter. It obviously allows for the elimination, and it's quite easy for them to do. Obviously, they can maintain the normal thing. The only downside is it can cause skin irritation. So where the glue sticks around the base of the penis, it can become quite sore because actually that's quite a lot of glue sticking there on. So when you do slide them off, there's certain lubricant gels that you can put on to release the sticky stuff. So just be mindful that could cause skin irritation. And obviously maintaining personal hygiene. So with the condom catheter, the penis is in plastic all day. So that's going to get quite sweaty and quite unpleasant quite quickly. So it is important to make sure that you are cleaning the penis correctly and every time that you apply them on.
In what circumstances we use this condom one?
So the condom one could be maybe that they just don't want an indwelling catheter. They don't want one going down the urethra shaft. It is there as an option. And obviously, you don't really need much training to put one on. You know, clean the penis, slide it on, connect your catheter bag. So a bit more dignified in some ways.
Can we? Oh, I don't know. Can we use this if the person doesn't want to use a pad? Is any helpful?
Yeah, absolutely. I mean, if you've got somebody who's going, look, I don't want to wear a pad. That's not pleasant. It is an option. It's a continence management tool. So you could say, well, look, what about a convene or a condom catheter? You could wear the condom catheter. It attaches to the bag as normal. It just sticks on your penis, and it's a bit more dignified, isn't it? So
to know.
Yeah, it's a great option. It is a great option for men. Obviously not so great for women because you don't get that option, but for men, it's a tool there.
So that, Steve, that was my question. Is that the condom catheter exactly the same as a convene?
No, so convene. Condom catheters are the same as convenes. They're called the same thing.
Okay.
Yeah. So some people call them convenes, some people call them condom catheters. Either is absolutely acceptable in the medical world. It's exactly the same thing. So yeah, so again, client presentation, talk to them, gain consent, introduce yourself, explain what you're going to do, why you're going to do it, and then obviously just communicate the language, run through what you're going to say, think about their dignity and privacy, show a bit of empathy, you know, and obviously just make sure that it's in the right place and you've got the right time and you're not being rushed. The reality is, I had a gentleman who had a stroke, and this was ideal for him because he didn't want to be catheterized. So I could use the convene. The only downside to him is his penis was a little bit shorter than national average. So the problem is, as you roll it back, there needs to be a fair amount of glue space for the condom to stick. If there's no shaft, if there's no base for it to stick to, it just rolls up and comes off. So it is an assessment thing. You are going to have to think about, is there enough space? And again, there is a little strap that you can put around the convenes that hold it into place as well. And again, the catheter is exactly the same. It just connects up like a normal catheter bag. So the tubey bit on the end just goes into a normal catheter. It's the same procedure. And again, online, there is a training video. So you can see there, you've got the penis. I don't know where they get these models from because no man that I've looked after has a penis like that. They're generally a lot shorter. So as you put it on, what normally happens is you place the convene or the condom catheter at the top of the penis. There's a blue tab normally that you can pull and it just rolls down, no different to like applying a condom, it just rolls down and then it sticks. If you haven't got enough base for it to stick on, it's not going to hold on. And then there's a tape that goes around the end to help it stay in place. And you can see on there at the end of the convene, it's got the bit where the catheter bag connects. So it is a great thing. Okay. Any questions on that?